Prostagenix is marketed to, quote, support urinary flow, improve sleep patterns, and reduce urgency. And while the product doesn't directly mention it, these claims refer to symptoms commonly associated with benign prostate hyperplasia, or BPH, a condition in men in which an enlarged prostate frequently causes urinary symptoms. Prostagenix boasts 1,000 milligrams of total sterols. But what exactly are sterols, and does this supplement actually work? The sterols in Prostagenix are a proprietary blend of plant sterols, also known as phytosterols. These are naturally occurring compounds found in the cell membranes of various plants and can be found in fruits, cereals, legumes, vegetable oils, nuts, and seeds. Because they're structurally similar to cholesterol, plant sterols compete with cholesterol for absorption in the digestive system, thereby reducing cholesterol levels. This makes them beneficial for heart health, but can they help with BPH? The key plant sterol in Prostagenix is beta-sitosterol. It is believed to help manage BPH by inhibiting the enzyme 5-alpha reductase, which converts testosterone into dihydrotestosterone, or DHT. Lowering DHT levels can alleviate BPH symptoms. Additionally, beta-sitosterol has anti-inflammatory properties that can reduce inflammation in the prostate gland. Research indicates that taking beta-sitosterol for up to 18 months can improve BPH symptoms. However, it does not appear to reduce the size of the actual prostate itself. In cases of more severe BPH, beta-sitosterol used for only 3 months did not significantly reduce most symptoms compared to a placebo. This suggests that beta-sitosterol is most effective for treating mild BPH symptoms when used for longer than 3 months. It may not be as effective for severe BPH or when used for shorter periods. Also, since beta-sitosterol doesn't affect prostate size, it provides symptomatic relief only, meaning you're likely going to need to keep using it for ongoing relief. If your prostate continues to grow, beta-sitosterol won't stop this progression, and standard medical intervention will still be needed. The other plant sterols in Prostagenix, such as campestrol and stigmasterol, have not been studied as exclusively. Although they are similar to beta-sitosterol in their ability to help with cholesterol levels, there is no evidence that these other sterols can help with BPH in the same way. What about the other ingredients in Prostagenix? Are they anything special? Let's examine whether there's any evidence they can help with BPH or other prostate issues. There's no evidence that vitamin D, zinc, or selenium supplementation can help with BPH or related symptoms. In fact, they have been studied for a more severe and possibly related neoplastic prostate condition, with findings showing that supplementation was not helpful. For vitamin D, a meta-analysis of clinical trials shows that high-dose supplementation does not affect progression or mortality in patients with prostate neoplasms. For zinc, a meta-analysis of population research found no association between zinc intake and the risk of prostate neoplasms. For selenium, a meta-analysis of clinical trials involving over 20,000 patients revealed that daily supplementation for up to 5 years does not reduce the risk of prostate neoplasms. A follow-up study of 7 to 14 years confirmed there was still no reduction in risk. Interestingly, a few observational studies seem to show the opposite, suggesting, for example, that higher levels of selenium are associated with lower risks of prostate neoplasms. However, these are associations with higher blood levels of selenium, not higher supplementation levels of selenium. Although it may seem like these two things are the same, since higher supplementation should lead to higher blood levels, this is a classic example of just because something is associated with it doesn't mean it caused it. The lowered risks are likely due to dietary factors, where people with healthier diets had higher selenium levels. Foods high in selenium include lean meats, nuts, and seeds, and those eating more of these healthy foods had higher selenium levels in their blood. Essentially, it was the healthier diets that lowered the risks of prostate neoplasms, while coincidentally raising selenium levels in the blood. But simply supplementing with selenium did not have the same protective effect. The minerals iodine, copper, manganese, chromium, molybdenum, silicone, and boron are not particularly helpful for BPH or any prostate-related conditions. Grape seed extract is one of the antioxidants in Prostagenix. While antioxidants are generally believed to help with inflammation, which is a component of BPH, we need to look at human research to see if supplementing with certain antioxidants can actually help. Clinical research in middle-aged and older men with lower urinary tract symptoms, or LUTS, which is often caused by BPH, shows that drinking 240 milliliters of 100% Concord grape juice daily for 3 months does not improve symptoms compared to a placebo. Pomegranate and its juices are often promoted for prostate health due to their high antioxidant content. While pomegranate hasn't been extensively studied for BPH, early research suggests that it might slow the rise of PSA levels in men with prostate neoplasms. It's important to note, though, that many of the researchers involved in this study had ties to the company producing the pomegranate extract. A larger, more reliable independent study later found that pomegranate didn't actually slow PSA levels in those with prostate neoplasms. Nonetheless, the doses used in these studies were 1 to 3 grams per day, far beyond what Prostagenix provides. Quercetin is a flavonoid found in foods such as onions, apples, berries, teas, and red wine. Although it hasn't been studied for BPH, it has been weakly studied in a few other different urinary conditions. For example, in chronic prostatitis, preliminary research shows that taking 500 milligrams of quercetin twice daily for 1 month reduces pain and improves quality of life in patients, but it does not seem to affect urinary symptoms compared to a placebo. Regardless, the dose in Prostagenix is far below what is used in the study. Let's summarize our analysis. First, let's remove minerals like iodine, copper, manganese, chromium, molybdenum, silicone, and boron, as they lack any medicinal value for prostate conditions. Next, we'll exclude nutrients and antioxidants such as vitamin D, zinc, selenium, grape seed extract, pomegranate extract, quercetin, and some of the other plant sterols. Although they have been studied for prostate conditions, they have not reliably shown any benefits, especially for urinary issues related to BPH. Finally, we identify beta-sitosterol as the only useful ingredient in Prostagenix for addressing the urinary symptoms in BPH. Therefore, Prostagenix is essentially an overpriced beta-sitosterol supplement and is likely not much more effective than other generic beta-sitosterol supplements for BPH and urinary symptoms. Prostagenix costs around $45 per month. To replicate what Prostagenix provides, I would combine beta-sitosterol with a multivitamin. Generic beta-sitosterol supplements cost around $5 to $6 per month, and a regular multivitamin costs around $4 to $5 per month. Combined, that's around $9 to $11 per month. Rating Prostagenix by effectiveness for improving BPH symptoms, I'm giving it a C. It may be useful for treating mild BPH symptoms thanks to the beta-sitosterol it contains. Rating it by cost, I'm giving it a D. It can be easily replicated at a far cheaper cost. Rating it for safety, I'm giving it a B. The ingredients and doses used are unlikely to cause concern. Overall rating, I'm giving a C. If you suffer from mild BPH, Prostagenix may be helpful for your symptoms, but it is not much more effective than generic beta-sitosterol supplements, which are much cheaper. Hi, I'm Dr. Brian Yeung. Do you think it's worth it? Let me know in the comments down below. And if you found this video helpful, please subscribe to the channel and leave me a like. Hit the notification bell if you want to stay up to date, and share this video with someone you know can use the info.